My grandmother lost part of her arm due to a cancer called melanoma. It is important to understand that melanoma is the leading cause of skin cancer death. How many of you like to relax poolside and bask in the sun? Who loves the feeling of lying in a tanning bed? Who has had a family member who has had a melanoma removed? I can say yes to all of the above. We should all care more about this topic because of the secret ways it attacks our bodies, life, and our family members. Today, I'm going to define what melanoma is, what the causes of melanoma are, and ways to help you avoid this cancer. First, what is melanoma? According to Mayo Clinic, melanoma is the most serious type of skin cancer. It develops in the cells that produce melanin, the pigment that gives your skin color. Melanoma can appear on your skin, but what does it look like? Usually like a flat mole with uneven edges and a shape that is not the same on both sides. It can be black, brown, or even more than one color. These moles may fade into the skin and have a flat part that is level with your skin. They may be smooth or slightly scaly, or may look rough and pebbly. Think about this. You are higher risk for melanoma if you have fair skin, family history of melanoma, or many abnormal or atypical moles. Melanoma can also be itchy or may appear as a sore that may bleed. At the early stages of melanoma, you may never notice anything, which is why this cancer can be so lethal. Just as any other cancer, it is best to catch it in its early stages. Early detection is very important. Watch for some of these warning signs and changes in your skin pigmentation. Next, let's discuss the causes of melanoma and how deadly it can become. Melanoma occurs when something goes awry in the melanin-producing cells that give color to our skin. Normally, skin cells develop in a controlled and orderly way. Healthy new cells push older cells towards our skin surface, where they die and eventually fall off. But with the cell's DNA damaged, new cells may begin to grow out of control and can eventually form a mass or cancerous cell, according to Mayo Clinic. The disease is easy to spot and remove when it appears on the skin as a primary melanoma. When it becomes metastatic, it becomes extremely deadly. Patients with stage 4 metastatic typically die within 6 to 12 months. Ultraviolet rays don't cause all melanomas, but puts you at higher risk of getting it. Think about the areas of our skin that never see sunlight. This is what indicates other factors that may contribute to your skin's risk of melanoma. Still, according to Mayo Clinic, doctors believe exposure to UV radiation from the sun and tanning lamps are the leading cause. It isn't quite clear how the DNA within the skin cells actually leads to melanoma, which is why the combination of other factors, including environmental and genetics, actually attribute to causes melanoma. Take a look at your family history or where you live and the accumulation of UV radiation you receive. The causes of melanoma can be from genetics, UV radiation, and environmental issues as discussed. Finally, let's discuss how to avoid melanoma. I'm sure that's everybody's question. There are several ways, but I'll just discuss a few. See a dermatologist. When researchers from Emory University School of Medicine looked at records of more than 2,000 melanoma patients, they found that those whose growth had been diagnosed by a dermatologist were more likely to have early-stage cancer and survive their disease. That's all I need to hear, than those who had seen just a regular doctor. I believe it's because dermatologists tend to not say it's nothing and brush it off. Second, drink coffee. Your daily coffee fix may help you fend off skin cancer. According to WebMD, for each cup of caffeinated java that you drink every day, there's a 5% drop in your odds of developing non-melanoma skin cancer later in life. Lastly, wear sunscreen. This may be obvious, but you would be surprised how many adults do not apply sunscreen when going outdoors or putting it on their children. Sunscreen labels tend to kind of be tricky, so the best bet is to not burn and wear sunblock. Or just use zinc oxide or titanium dioxide, which are both physical blockers against all rays. That also is according to WebMD. Those are just a few ways to avoid any risk of melanoma. In conclusion, I think we can all agree that knowing what melanoma is, the causes of melanoma, and how to avoid contracting melanoma will decrease our chances of getting it. We need to care more about this topic for better prevention. I hope that this discussion has given you the information you need to arm yourself, your family, against this dreaded cancer, thereby preventing you from any pain or suffering. Although my grandmother still has her life, she's still missing part of her arm, and deals with the daily pain that this cancer has left her. Let's all become more aware. Thank you.